I feel like the primary survey gets all the love and we don't spend enough time talking about the adjuncts or the adjunct studies to the primary survey. So let's go through those right now because I think those are just as important. All right, so we do our primary survey for a trauma patient, ATLS. Let's just run through that super quick. It's the ABCs. So airway, cervical spine precautions, B, breathing, C, circulation, D, disability, E, exposure. And then we have adjuncts to the primary survey. And I don't know that they're talked about as they're super, super important. And truthfully, the most important one, I think, is the FAST exam. So focused abdominal sonography for trauma, but we do like what we call an EFAST nowadays because the subxiphoid view is going to get you the pericardium. So we need to see if there's a traumatic pericardial effusion. But then we also look at both lung windows on the extended or EFAST to see if the lungs are up. And then to also see if the lungs are up, obviously we get our chest x-ray. This gives us information too, especially if we intubated a patient, to know where our ET tube is, or if there was something catastrophic on the primary survey, we do already know where our chest tube or our thoracostomy tubes are. So we can look at these. And again, if maybe we didn't capture that hemopneumothorax there, we would see it on the chest x-ray. And then my favorite picture here always is also, what if we have a big old widened mediastinum? So there's a lot of important things we could take away from the chest x-ray. And then I had a case too the other day with the pelvis x-ray. We had a hemodynamically unstable patient, and then you get this, and all of a sudden the pelvic ring is open here. So you have an open pelvis, and what do we need to do in that situation? Well, we have to throw on our pelvic binder, okay? So again, a lot of life-threatening things that may not be overtly obvious during that primary survey, and that's why you do the adjuncts here.